In Denmark, 600 children are born each year with hip dysplasia, but only 1 in 5 cases is detected in time. At Aalborg University Hospital, we have therefore tested a new method that detects the condition more quickly and effectively. Hip dysplasia is a congenital condition in which the hip socket, which is normally round, is underdeveloped and flat. This causes the head of the femur to sit unstably in the joint. Over time, children with hip dysplasia may experience pain and difficulty walking, early onset hip osteoarthritis, and in the worst cases, hip dislocation. There are gentle and effective treatments for hip dysplasia. If the condition is detected early, it can almost always be treated with a simple brace or harness. If it is discovered late, however, surgery and hospitalization may be necessary. All newborns must be screened for hip dysplasia. As it stands today, a midwife or doctor examines the hips and asks the parents about factors that increase the risk of hip dysplasia. Risk factors can include a family history of hip dysplasia or if the baby was born in breech position. If a risk factor is present or there is suspicion that the hip is unstable, the child is referred for a specialized ultrasound examination of the hips. Unfortunately, the initial examination by the midwife or doctor is not sensitive enough, and many children who actually have hip dysplasia are not referred for further testing. If all children were instead referred for a specialized ultrasound of the hips, all cases of hip dysplasia could be detected. However, such comprehensive screening of all newborns would overload the specialists who perform the ultrasound scans. In our new research project, we have therefore tested a new and simpler form of hip ultrasound that does not require a specialist. With the help of midwives, we scan the hips of 2,735 children using this new method. If the scan raised suspicion of hip dysplasia, the child was referred for a specialized ultrasound examination of the hips. Using this new simple ultrasound scan of the hips, 60% more cases of hip dysplasia were found. This new simple ultrasound scan of all children's hips can increase the number of children who are diagnosed with hip dysplasia early, and thereby give them a better chance to start life with healthy hips.